Alright, welcome everyone. Today's video is going to be about fractional CO2 laser resurfacing. We're doing questions and answers. So today, in today's video, I'm going to go through what fractional CO2 laser resurfacing is and what it does. Today, we do have a full day of fractional CO2 laser resurfacing treatments. We will be streaming one of them on Instagram Live with Crystal Lena, and you can watch that. And we're going to talk about what it does. So, what does fractional CO2 laser resurfacing do? So, fractional CO2 laser resurfacing uses a CO2 laser which targets the water in the skin. And because about 2/3 of the skin is water, when it hits it, it's going to evaporate. Okay? It also generates a lot of heat. Now, this is fractional as opposed to full surface or confluent, which means instead of treating the entire surface of the skin, we're only treating a fraction of the skin. So what you see is tiny little dots on the skin, and we produce thousands of CO2 channels. So we produce tiny little holes in the skin, and around that skin it generates a lot of heat. And the benefit of that is that instead of treating the whole skin, you're just treating a fraction of it. So you have a tiny dot where the skin is treated, and then around it you have normal skin. This allows for faster healing. In the past, when they did full surface or confluent CO2 laser resurfacing treatments, the recovery was 2 months or 3 months of redness. With this, it's only 1 week or 2 weeks, depending on the area. The face heals faster. So what does this do for the skin? What it does is it stimulates the formation of new, fresh, and healthy collagen in the skin. And what is collagen? Collagen is the protein in the skin that keeps the skin nice and tight and firm and youthful in appearance. As we age, we lose the collagen. And what happens as a result is you get wrinkles, you get fine lines, you get saggy skin, things start to sink. You see these lines here, you see jowls, you see decreased definition of the jawline. So this will help with that. There are other things that happen in the skin which damage the collagen. For example, acne. A lot of people have what we call acne scars. So it's important to differentiate the difference between true acne scars and discolorations. Sometimes after an acne lesion or an acne breakout, a dark spot is left over. That's a discoloration or post-inflammatory hyperpigmentation. It's not a true scar. A true scar is when you have acne and you pop the pimple, and it pops, and then later on, days, weeks, or months later, you get an irregular texture in the scar so that it's indented. And you can feel that on the surface when you touch the skin. You get these pitted scars, or they're called atrophic scars, and there are several different types. These are true acne scars. The reason why it's important to differentiate the discoloration or hyperpigmentation from true acne scars is because the treatments are different. For discolorations or hyperpigmentation, we can treat that with creams, brightening creams, antioxidants. We can use IPL lasers and so forth. For the true acne scars, that we have to treat with a laser resurfacing. What happens when you pop those pimples, the contents of it, the pus is released into the skin. That leads to an inflammatory reaction, and as a result, what happens is the collagen in the skin is damaged. So instead of the surface of the skin being smooth, you get these indented scars or atrophic scars, and that's a true acne scar. So the fractional laser, the CO2, will stimulate the formation of new, fresh, and healthy collagen to fix that or correct that. So instead of having this pitted scar, the skin becomes smooth. You can also see these with stretch marks. When people gain weight, oftentimes it's from pregnancy, and then they lose it. It's leftover, stretch marks are left over. So this is the same kind of thing. It's abnormal collagen. So fractional CO2 laser resurfacing can be used to treat that. And as a matter of fact, we are going to do one today, and we'll have that on our YouTube soon, so you can view that. So it does exactly the same thing, but it's used on a different part of the skin. So I'm going to go through some of these questions. If you have questions, feel free to ask us. We are on live. Welcome to everyone who's joining us live. We will have this available online afterwards for people who will be joining us later or would like to view it later. What are the popular areas that are treated? The most popular area that's treated is the face. It works for fine lines, wrinkles. It's a great alternative to a facelift. It can also clear up the skin, the color, the texture, the tone. It will give you a bright glow. It can also be used on the neck and chest, as well as the hands. It could be used anywhere on the body. As we discussed, it can be used on stretch marks, generally on the abdomen, but they could be anywhere on the skin. And the neck and the hands are actually very common treatments. The most common is the face, but a lot of people, once they treat the face, their face looks nice and fresh and youthful, and then their neck doesn't match. So people start noticing that. So then they start doing their neck. And then the same thing with the hands. When you shake someone's hands, they look at the sun damage on the hands, and the hands look old, but the face looks young. There's a mismatch. So we do that as well. How many treatments will I need? So usually one treatment, sometimes 2 or 3, depending on the specific condition. For example, if the acne scars are deep, you may have to do more treatments. When will I see the results? So you will not see the results of this right away. It does take time. We need to form the collagen. Collagen does not form overnight. It takes months to do it. So when you do one treatment or a series of 2 or 3 treatments, you may start seeing a good improvement after a week or 2, but the real results are going to be between 3 to 6 months or from 6 to 12 months. So you do have to be patient. That's the thing that's challenging about this. So what happens during the treatment? When you come in, we take baseline photographs, we apply numbing cream, let that sit for about an hour or sometimes less depending on the area and how aggressive we go. We also do provide medications to keep you comfortable. It does make you sleepy, so you want someone to drive you home because you don't want to drive for about 24 hours after that. After that, we bring you back into the treatment room, clean you off with some water and some cleansing solution. We do provide some eye protection for your eyes, and then we do the treatment. If you want to see exactly what the treatment looks like, we do have videos of the demonstrations on YouTube. And the treatment can take anywhere from 15 minutes to an hour, depending on the area, the number of areas, and the size of the areas. Typically a full face we do in about 15 to 20 minutes, but if you're doing a larger area, like the abdomen, it can take longer, and if you're doing multiple areas, of course it's going to take longer. We did one time face, neck, and chest all in one session, and that took about an hour or an hour and 15 minutes. After the treatment, it's going to be red, it's going to feel hot, it could be swollen. We do apply some spray water that helps keep you comfortable, and we use cold air during the treatment. So after the treatment, you'll cool down with that for about 15 minutes, and then we'll apply some intense moisturizer and sunscreen, and you're good to go. And what's the recovery like? So the recovery, you're going to have a good amount of redness and swelling for the first week or sometimes 2 weeks. As I said, on the face, the recovery is faster. From the neck down, it takes longer to recover. So the first 2 to 3 days, you probably don't want to go out or be seen. So prepare for that. A lot of people do this when they have a vacation, or they'll do it on a Friday if there's a holiday on the following Monday, so they can have a full 3.5 days off before going back to work. And then the redness will slowly subside. You will see the tiny little dots, and that might peel off or scab or crust off. We do give you an Aftercare kit with a spray water and intense moisturizer. Apply that several times a day for the first week or so. Put a small amount of the spray water. We use the Aven thermal water, followed by a very thin layer of the Ulta MD Intense Moisturizer. If you put too thick a layer, it could cause breakouts. Do that for the first week or two. We also use the Elastin Skin Nectar, which is a great product that has a proprietary trihex peptide technology that stimulates collagen, it stimulates elastin, and it clears the extracellular matrix in the skin, and that allows for improved results and faster recovery. You can use that twice a day, starting 2 weeks before a treatment and continuing for 1 to 2 weeks after a treatment. You don't have to stop that product. We also give you some medications to prevent infections. So there are 2 of them. There's Keflex and Valtrex that are taken once a day for 7 days. This is for prophylaxis to prevent infections. And people who are allergic to penicillin, we use clindamycin instead. What else? The other questions that we have here. If you have other products that you're using, such as retinoids, retinol, hydroquinone, retin-A, salicylic acid, glycolic acid, any of those things, you want to stop that about a week before and a week after the treatment. The reason is because that can irritate the skin and cause more redness. So let's see what we have. What will happen is the treatment uncomfortable with the medications that we use and with the numbing cream and with the cold air. Most people tolerate it just fine. Usually on a scale of 0 to 10, people rate it somewhere between 1 and 5. Aftercare results. So those are all the questions we have. Again, check out our videos. We will have them on YouTube. In terms of the demonstration, we do live feeds. Please follow us on Facebook, Twitter, YouTube, Instagram, Snapchat. We're also on Yelp and Real Self, and I have a weekly blog on Instagram and Snapchat. We do a daily question and answer session. Send us your questions and I answer them personally, and we'll go from there. Thank you again for joining us, and we'll see you next time.